Time for Wellness Wednesday. As the temperatures begin to rise again, it's very important to be careful with your water intake. Dehydration can be more than just not drinking enough fluids. Here to talk more about this is Dr. Janice Coffin, Dr. Brian Uzamba, and Dr. Charles Cosby, all with AU Health. Thank you so much.
Good morning, everybody.
Good morning. Good morning.
This is really good to talk about, especially with so many people going to be outdoors on the golf course. Dr. Uzamba, break down what is dehydration.
So dehydration is when you're losing more water than you're taking in. And at a certain point, when you're not having enough water intake, you don't meet your body's natural demands throughout the daily course of the day. And due to that, some common causes of dehydration could be fevers, could be vomiting, diarrhea, and you can lose up to 1 to 2 liters of water through your skin alone, especially if you're out for an extended period of time in hot weather. So it's very important that you stay hydrated.
Okay, so nothing that we want to do or want to have happen to us. How much should viewers actually have to have within a 24-hour period?
So within the 24-hour period, it's recommended that you consume at least half of your body weight in water. For example, if you're 200 pounds, we want you to consume at least 100 ounces of water within 24 hours. On average, we recommend that a male should consume at least 3 to 4 liters of water within 24 hours. And for a woman, they should consume at least 2 to 3 liters of water within 24 hours in order to stay adequately hydrated. And a sign of this can be if your urine is very dark, this means you should be drinking more water.
Okay.
Good things to remember. So actually dehydration and heat-related injuries go hand in hand. Can we talk about some of those symptoms when it comes to heat-related injuries?
Yeah, so with heat-related injuries, one of the more common things we see typically would be like a sunburn, so that would be red, hot, blistered skin. As far as dehydration goes, kind of on the same route, excessive sweating, increased thirst, decreased urine output, really dark urine, or some of the kind of more common things you'd see. The things that are more worrisome, if you feel like you're going to pass out, throwing up, things like that, really fatigued or confused, those would be reasons to seek medical attention immediately.
And are there populations that are more susceptible to dehydration?
Yes, so some of the populations that are more susceptible or are at a higher risk of dehydration really are pregnant women, newborns, really young children, as well as those who are elderly or those with chronic illnesses. They're typically the ones who are at higher risks.
And I think something to note when we were talking about drinking water, we should be drinking water on a daily basis no matter how hot or how cold it is outside. I mean, sometimes we think when we go outside, it's hot, you want to drink water naturally, but that's not always the case. This should be something happening every day.
Absolutely.
Absolutely.
Okay. And Dr. Coffin, what can viewers do to prevent dehydration and heat-related injuries?
Yeah, so no, that's a great question. So, obviously the big tournament's coming up this week, lots of sports going on for both kids and adults. So just make sure that if you're going outside, as Dr. Uzamba stated, we want to make sure that we're drinking at least half of our body weight in water. So what I will say is this, sometimes we like to go out in sporting events and sometimes we like to have something that's non-water related like beer or wine. So if you're going to drink that, make sure that you drink a glass of water with that. If you're going to be outdoors, again, for men 2 to 3 liters, women 1 to 3 liters. If you're thirsty, that means that you are exhibiting signs of dehydration. So make sure you're drinking plenty of fluids. If you're outside, guys, wear loose clothing that's light colored. Make sure that if you do go outside, even if it's cloudy outside, you're putting sunscreen on. Make sure that your pets are out there in the heat. Try to put your pet in where it's cooler. Again, if you're outside and you start feeling like you're feeling faint, you're feeling thirsty, make sure, again, get water, go someplace indoors that's, either in the shade or in air conditioning. Again, make sure you're drinking plenty of water. A lot of people are either flying in for the tournament or people are leaving because it's spring break. Just remember, if you're going someplace hot, make sure light clothing, loose clothing, plenty of hydration. Make sure if you're taking any chronic medications, you take that with you. Again, if you have any chronic related illnesses, make sure that you, again, stay well hydrated.
The body will tell you what it needs. Dr. Coffin, where can people go to get more information?
Yeah, so great. So that is a great question. So obviously we work at Augusta University, so you can go to augustahealth.org. Another great website is the Center for Disease Control, so cdc.gov. They have a lot of great information regarding dehydration, and they actually have solutions that you can use if you want to drink something other than in water. So please be safe out there. Be safe for spring break. Tournaments coming up. Welcome everyone here. And quick shout out to Brenda McBride and Priscilla Wynn and anyone who's coming in to play this tournament this upcoming week. So stay well, stay hydrated, and stay healthy.
All right, very well said. Thank you so much, Dr. Coffin, Dr. Uzamba, and Dr. Cosby. Thank you all, and we appreciate what you do.
Thank you
so much for having us.
Thank you.
Yes.
Thank you.